Thank you, Bernard. It's amazing to be here. The new year, 18 days already into the new year. In fact, it's hard to believe, Dr. Prasad, that it was 10 days ago that we
Yeah,
were celebrating your birthday.
yeah,
And yeah, this is the time to be alive, time to be excited. A lot of calls are happening. In fact, already, just like you referenced, Bernard, where Dr. Prasad is helping out with those that are in a hospital setting and questioning whether or not these products can be used together with certain things. I've also had Dr. Prasad on several calls where we have been talking the significance of these products, these formulations, and how different they are than anything else that's out on the market. But before we get too far, I would like to pull up the disclaimer to keep ourselves protected. If you
yes.
want to go ahead and just follow along with me. These statements and comments have not been evaluated by the Food and Drug Administration. This information is solely for educational purposes only and includes recent advances in research on micronutrients. Engage. The micronutrient company does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. However, Engage's products are formulated to address nutritional deficiencies and supply the body with the required nutrients. It's important to note that nothing here is meant to be a substitute for professional medical treatment or consultation with your primary healthcare provider. And so let me move those words out of the way and just jump right into the stories that are available to us. I want to just share with everybody here in the sound of my voice on this Sunday afternoon, early evening, as you're joining us. It is just amazing to see people's lives change. And I want to share with you, many of you know of Helen and I's travels and how we went from celebrations during Thanksgiving and Christmas right down to Nevada, where we ended up connecting with an individual. We were also in Ohio. And I just want to share with you, this is one of our good friends. His name is Terry. And Terry is in the hospital just so you're coming into the end of the year. And this is how Terry looked. You can see how orange he is, yellow. This is his youngest sister. And they took a picture of him right here in bed, diagnosed with pancreatic cancer and also liver cancer on top of it. We ran some of the micro daily to him, met him in the hospital and shared it with him. He went home to Ohio for a few days and then out to another good friend of ours. Uh, and many of you know Dr. Linda, but I just want to share some exciting things with you. On the 29th of of December, this is how Terry's blood looked. And I'm just going to put this up here in front of everybody. You can see Terry's blood work on December 29th. And look at the difference in his blood from 22, 23, 24. Those are the numbers of the pictures on the top. You can see the large white aspects in there. You can see just it was very, very difficult. But then in just this was 5 days is what the difference was. It was amazing to see on Dr. Prasad's protocol with the 3 times a day, 3 times the dose, to see the differences that are occurring right there. And when Helen and I came back from Dr. Prasad's birthday party, we stopped in and we saw Terry. And even though he still has a little bit of that yellow coloring, look, he's up, he's walking around, he's doing so much better. And I'm grateful that we are here, that we have access to Dr. Prasad. The hope that this gives to the world is just amazing. So anyway, from there, you can see he's just not a lot of hope, not a lot of life left in that body, and the difference that we are experiencing right there, and we can see it in the transition in his blood work. So I just wanted to start out today with that story, being a story that I'm connected with, and to see how quickly these things are happening for others. And so, with that, let's just open it for those of you that want to share your stories. What's happened to you through the holidays as we transition from 2025 into 2026? What are some of your favorite responses that our bodies are given when we are correcting those nutritional deficiencies? Who would like to come on and share their experiences first? I don't want to take any more time myself here, because this is all about your story and how your story is going to impact the life of some others. And I hope what I shared here with Terry, one of our good friends, is inspiring for those of you that are here. And again, we're not making medical claims. We're just saying, hey, look at the difference in his blood work. Look at how much more life energy Terry has just after a few weeks. At this point, that's when we took that second picture. So Cynthia Scott has her hand up, and Cynthia, we're looking forward to having you share your experience. And so I saw the hand, and then I did.
Yeah.
There you go.
So I wanted to do mine because mine is not, mind blowing or anything. Um, so I got my product last Tuesday evening, and so I have Polycythemia Vera. It's been almost 6 years now, and I'm on a daily chemo pill that causes exhaustion, brain fog, and all that, memory and all that. So when I got it in the mail Tuesday afternoon, I was like, okay, I'm not waiting. I'm taking this now. And I ordered the minimum amount because of finances. So with dinner, I took the amount for the whole day instead of just for the evening. So I took 2 of the micro daily EMF and 2 of the original micro daily and 2 probiotic prebiotic, and woke up the next morning. I was like, ooh, I'm not stiff. Ooh, huh, my body feel kind of good, and I slept pretty good. And I'm like, nah, that can't be the stuff. It's just, happened. And so the next morning, I took one EMF probiotic, 2 original, and then the probiotic, the 2. And that's what I've been doing, till today. It's not a week yet. So Thursday, I had lots of paperwork and things to do, a lot of running around, getting finances and stuff in line to make a purchase. And there was, some hiccups here and there. Normally, I wouldn't be able to do it without becoming anxious. And it's like, okay, wait, I can't think. Hold on. You have to do it. Went through it, didn't get upset, nothing. And today, I don't feel like I'm even sick. That's my story. Mm-hmm. I'm not one to exaggerate nothing. So that's
wow,
it.
wow,
And
wow,
and
Cynthia.
that's taking the minimum.
That's that's amazing. That is just absolutely amazing. Appreciate that. So, wow, what a way to start this out. Just again, Dr. Prasad has said anytime you're in um, that situation where you're facing a diagnosis with that um, that word that starts with a C that rhymes with answer, that you do the therapeutic dose. That's 3 times the dose, 3 times a day. And just as even Cynthia came on, she was so excited about the formulations arriving, the microdaily EMF, the probiotic, and she did a combination of the EMF and just the microdaily original formula just for a again, she shared because of the overall cost and included that all in just, well, she counted out those days for us. So it's really amazing that we're already seeing and experiencing and noticing a difference, and have Cynthia come on and share that with us. It's just amazing. Bernard, do you want to give us a little bit more on the
Yeah,
background there?
no, Cynthia. Cynthia has been calling me for the last 2 weeks to make sure that she took the products the right way. And this is for the ones that are on here. That's you're coming up with customers, and retention really is going to be the key toward helping anyone. So with Cynthia, she kept asking questions. We talked about the EMF, the original, the probiotic. Those are the strongest combinations that you're going to have. Dr. Prasad always highlights, he says, the more EMF, the better it is. And Dr. Prasad, like he has something to say on this. The more
Yeah.
EMF, also the better the cancer situation. Go ahead, Doctor. I'm not going to interfere. My people told me when you start speaking to shut up, and I'm going
Yeah,
to listen.
I think one thing I want to warn people, when I presume she has a cancer.
Yes, it's
And
Polycythemia Vera, it's a blood cancer.
if you take a low dose, then what happens, it might stimulate the growth of the cancer, one. Second thing is, it might interfere the effectiveness of chemo and radiation therapy. It might look like you don't have what you call side effects because you are taking the what you call low dose, and low dose antioxidant destroy free radicals. And a chemotherapeutic agent or radiation produces a free radicals. So it will reduce the effectiveness of chemo and radiation if you are taking a low dose of antioxidant. It does make difference if you are taking a high dose, therapeutic dose. Say you take a two, one, say take a one, the microdaily EMF and two original one, that will be okay. But has to be combination of 3 in morning, after breakfast, after lunch, and after dinner. Has to be with some food in your stomach. Otherwise, one person was taking not food at all. And if you don't have any food in your stomach, antioxidant, many of them will not be absorbed.
You know, one thing that Dr. Prasad said true, too, is a lot of people have been concerned about the cost of it to get started. And Jeff, you may want to make a comment on this because some people don't realize that the therapeutic dose has a time period that it is proven to be very effective. And perhaps Dr. Prasad, so people don't get a little nervous, that their cancer, Jeff always say the answer C is on, but we're just generally talking about people's experience. When people are going through that, the question you have to ask yourself is your situation dire enough to stay on this regimen for at least 3 to 4 months and get the results that you're looking for? After 3 to 4 months, what happens? It teeters down. I think that's what you were saying, Dr. Batai, right? It's kind of like teetering down to a maintenance dose. So you may be talking about 2, 3, maybe 400, maybe $500 for the month for 3 months. But if you're going through a ride with answer C, what you're going through, is it worth it to stay on something for $300, $400, $500 for 3 months in order to beat it? Actually, I think with the way that the medical demanding all these thousands of dollars, I believe it's a gimme that this is the best regimen you can have, Dr. Prasad.
But, if she have tried it and it works for her with respect to, it is expected that she will feel better because destroys the, free radicals that are produced by chemo and radiation. So she will feel better, that is expected. But the question is, what is happening to the tumor?
Yeah. Yeah, that's why it's important that we stick on that 3 times the dose, 3 times a day regimen. It's just hypercritical. We went
And
to find out,
probiotics,
and the
one in the
probiotics.
evening and two in the morning. So
Yeah.
it is so crucial. But I understand the cost.
Well, that's
So,
awesome.
so I have a question. Because my polycythemia vera is caused by the JAK2 mutation in the bone marrow. Okay. So the red blood cells produces too much for the body. Okay. So is that the same as like a tumor?
No, I mean
No.
that's a reflection of what's going on in your body. But
Okay.
if tumor grows, what kind of tumor you had? Pink?
I
It's
didn't have a
it's a
tumor.
it's a blood condition. It's a blood
Yeah.
condition.
Blood,
But it,
Yeah.
yeah.
Disorder. Uh-huh.
So blood condition, so that condition leads to some changes. There's no question about it.
Yeah.
So maybe it is a protected the blood cell from the free radical damage. But the
Right.
question is he going to go convert it to a normal blood cell, not
Right.
producing more? Because if you have a cancer of blood cell, if you have a cancer as a blood cell, they will grow rapidly.
Mm-hmm.
So the question is calm down, and those picture you saw, I thought it was a solid tumor, but if it is
Mm-hmm.
these things, for there is some protection. So you
Yeah.
saw, I mean, changes, but has nothing to do
Definitely.
with regression. You know,
yep.
cure of towards the reducing the
Mm-hmm.
cancer. See what
Yeah.
I mean?
Yep.
Yeah. Okay.
Awesome.
Yeah.
Thank
Have a
you,
doctor's
Cynthia.
appointment.
Yeah,
Find
yeah.
out how it's going.
We're about as far off into the weeds as we can get when it comes to diagnosis and Dr. Prasad offering suggestions. So let's leave it at that. Uh, any times you have a situation like my father faced, it's important that you get back with the individual who invited you on, who shared this with you, and we can answer your questions directly, and uh, and have you speak with others that have been through this very similar process. It's again very exciting times to be part of all of this, and thank you, Dr. Prasad, for stepping in and offering some further wisdom. This is important. Okay, so I'm gonna just pull the
Well,
spotlight
Jeff,
off Dr. Prasad. Yeah.
hey Jeff, you got one person on here that I'm going to call out.
Okay.
That she
All
called
right.
this call is about any products that are being successful. Is that true?
Correct. This called
Okay.
any of the micro daily products. Go ahead. Yes.
Any of the micro daily products that are working. Karen Blocker called me. Karen is on here. I don't know whether she's willing to unmute. She doesn't have to bring a picture up if she doesn't want. But she told me an incredible story that all of a sudden, after she called me, a few other people called and said the same thing. So some of my people that keeps calling me and come on these calls and act like they're sitting there like I'm going to call you out if you don't speak up. So Karen, you're the first one that I'm calling out.
Okay. Is this Karen Jenkins?
Yes,
All right. All right. We'll definitely pull you up here.
Yeah, I'm
Thank
sorry,
you.
Karen Jenkins.
There we go. Okay.
I have several experiences with microdaily since I've been on the products. I've had 3 strokes. My son had a car accident, a brain and spinal cord injury. And so recently I myself was back in the hospital and the boost was just coming out. And I started on the boost and I'm back at my old self. I have energy and I get up in the morning going and going and going, and it has helped me tremendously. So I can say all the micro daily products have helped me, my son, as well as my 82-year-old and my 83-year-old aunt. They are on the micro daily, the core 4, and also the brain boost. and the boost. So we are a micro daily family forever.
That's good. I'm 91. I'm doing okay.
That's that's awesome. Thank you, Karen. Now, so when you're
Thank
talking
you.
the boost, you're talking about the energy boost that just came out, correct?
The energy boost,
Energy
because
boost.
I went
Awesome.
to the hospital and I came back and I was not feeling the same. And I stayed in the hospital 3 days. And as it turns out, I had an extremely bad UTI.
Hmm.
And after that, of being on antibiotics and the whole 9 yards, so the boost came in, and I took the boost, and that was the only thing that brought me back up to my energy level and back to myself, was the energy boost.
Fantastic. Way to go.
Mhm.
That's amazing.
Mhm.
Alrighty. Wow. Dr. Prasad, that's one of your most recent
Tell you,
and
that is going to be the best. Another thing, the new product that we have, it is applied to every age person. Because a young person, college or high school, not all, some of them suffer for depression, anxiety for many reasons, maybe temporarily, but they take it to go away, and then go to your duty, do whatever you are doing.
yeah,
So
it
this is the
is.
one product that we have a same product for everybody.
It is it's really a great appeal. And in fact, as I started out that story with Terry, we actually sent some of the boost to him, and he was doing 2 sticks a day, one in the morning and one in the afternoon, when he would go into a little bit of an energy decline, and it really helped his body stay hydrated. And that cellular energy is so important when somebody
Yeah,
is really fighting something. So
yeah.
it's pretty amazing. All right, so I know we had Sharay's hand up. I saw it for just a moment. Is that something that Sharray, did you want to add anything to today's day of
Ye-
stories? Yes, go ahead.
ye- Yes, I will. Look, I'm driving. I'm running some errands. Hold on a
Okay.
second.
All right. Now if we
Okay. Okay. Um. Well. My story is in September of uh, September of 23. I was diagnosed with a HER2 um, breast cancer, triple negative breast cancer. Um, I went through the regimens, started my chemo. I did not meet Bernard and Michelle until January of last year. Like I said, I started September, October, November, December, 5 months of my chemo. I met them in January. And really, I was only going there for another type of service that his wife offers at her spa. And she kept asking me about, did I want to try the products? And of course, like everybody else, I was skeptical because I've tried so many different things. They got so many things on the market. How could I have, I'm like, I know everything. I know everything on the market. How could I not know about this? So eventually her husband seen me on my third visit, and he asked me to try, he said some people that's in my condition have tried the products and it has worked for them. And I said, okay, I'm gonna listen to the meeting. He invited me to look at the meeting on that Sunday. I looked at the meeting. I enjoyed everything that Dr. Prasad said, and I said, well, let me go ahead and try it. What's the least they could do, being diagnosed with this type of cancer, because it's a very aggressive form of cancer. As I stated, I started on the products in January. At the end of February, my doctors was telling me my numbers look good, everything looked good, everything was, perfect, according to them. And like the young lady said, when you're on the chemo, you got brain fog. You can't really understand everything clearly. But I just started grasping, oh, my numbers look good. My numbers look good. So as I continue on my treatments, that's what I started wanting to know. What does those good numbers mean? Well, for me, in my case, thank God, I was able to get a reduction of my chemo. I was supposed to get 28 rounds of chemo. My doctor said that through the scan, I only did 13 rounds, and from that, I didn't do radiation, which was suggested, but I said, well, let me just continue on my therapeutic dose and we'll see what happens. Next month, February, I would be going to get my next body scan, my PET scan. And so far, everything still look good. And I'm working on, from that, the doctor said she would let me know if I could get the port out. So I've been happy with the products, but like everybody else. And I do feel amazed that some days it's like I can't believe it. I can't. You forget that you was once a sick person. But I've been blessed to have been introduced to Bernard and Michelle and this whole engaged family. They've been wonderful, encouraging, and I just tell everybody, it's skepticism, but at least try it. Try it to see, give yourself a chance, fight for yourself, because that's what I always say. If it wasn't for Engage, I wouldn't have been able to fight for my own life. So thank you guys. Y'all have a good day.
Wow. Wow. Thank you, Sharray. That is awesome. And I feel like I need to have Bernard come up here. And how does that make you feel, Bernard, when you get somebody like Sharray, because you opened your mouth, because you suggested it? Look at the difference that it's made in her life. And so I'm gonna have you just add a little bit to that if you could, Bernard. That's amazing.
Well, when I first saw Shereen when she came in, I have to admit, I saw her when I was sitting my back porch, and Shereen walking almost like death. She had told me some intimate details that she didn't share with y'all, but let's just say the cancer was so bad that they had said the worst of things they had to do, and I'm not going to say it if she didn't say it. So, but as through her journey, here's what I have found. I've been with the company for about 3.5 years. Here's what I found. The responsibility of every one of us when it comes to our friends, family, or anybody that we want to get well, we're going to have to actually separate Dr. Prasad products from all the stuff on the store shelves and people that are recommending so many things out here that doesn't work. Now, you can't save the world with products. I know that. But in her case, I gave her attention because she gave me a listening ear and gave me a chance. And sometimes people don't open their mouth because they feel that individual is not going to really respect the point that you have something that actually works. In her case, I told her, I said, if you can stay on our products for up to 90 days, I said, generally within 6 weeks to 90 days, we get some incredible stories and results from our product. And she agreed to it. And I made sure that we called her, and we'll verify this. We called her to make sure she was taking the product right. And we were really right along with her through her journey, through her experience of this, because from what I understand, the doctors wasn't giving her more hope. And the same thing with Charlie and his people. So after we shared it, and then her stuff started getting so good. Actually, I was sitting up saying, "Man, this is amazing." And so I think when she went on and she saw the validation of Dr. Kedar Prasad, the point that she was able to go on the internet and find his name. 99% of the products out here, you don't know who made them, and you don't know who threw together this stuff. But Dr. Prasad, you can read about him. Then she saw where his 33 books, his now it's over 300 PubMed publications. And Dr. Prasad is not afraid to speak up and let you know that through his research, he's been blessed enough to come up with a formulation that works for most people, for most conditions that involve things that are inflammatory, things that involve all this stuff. So in this case, I'd have to say, and there's a lot of people on here right now They have stories. They're not talking. I think it's kind of an injustice to your people to not let people know on here that you've seen the amazing results of Dr. Kedar Prasad's products. So that's why I make sure everybody knows that he is a wonderful, wonderful scientist that dedicated his life, about to turn 92 years old. And I have to say, Dr. Prasad, I come on here on Sunday because I think it's just a privilege to be before you, and your love for people and your dedication to your cause of bringing health and wellness to the world is something I'll never forget. And I'll stay right next to you all the way through the whole experience. Thank you so much.
Thank you, Bernard.
And I'm sorry, Jeff, I took a long time, but I
Uh,
have to thank Prasad.
Well, thank you for giving us the rest of the story. We have Elizabeth Henry and then Dolores Levat here. So we will bring Elizabeth up and you can share your experiences. Here we go.
Okay, my story deals with Graves' disease. It was life-threatening. I was toxic to the mildest form of the pharmaceutical being used. This was in 2022. And of course, my numbers went terrible. My blood numbers, my white blood cell count was 2.8. Platelets diminished, so did the red cells. And I couldn't take the medication. I tried everything I could do naturally. I changed my diet. But then I had to go back on that medication at a reduced rate as I couldn't get out of the hyperstate. They feared that I would have a heart attack, that all my hormones, thyroid hormones, would dump at one time. They call it a thyroid storm. They said that my only option was to have my thyroid removed. But they couldn't do that as long as I was in the hyperstate, and I couldn't get out of the hyperstate. So I started doing everything I could naturally, but only after I learned about microdaily did my numbers change. After about 6 weeks, not only were my thyroid numbers normal, but my blood numbers are normal, and they continue to do that. So I don't take anything for my hormones, for my thyroid, and I still have it. Just recently, my sister, who's 87 years old, lives in Buffalo, New York, was put on palliative care. She was falling. The emergency people would come and pick her up, and they ruled that if she ever had another fall, they were going to put her on, maybe in a nursing home. So we had a family conference call, her children, along with me and her doctor. I heard the doctor ask her if she wanted to go to a nursing home or to live with one of her children. In a very strong voice, she said, "I'm not going to the nursing home nor to live with any of my children until I don't know who I am and I don't know who they are." So she showed a lot of determination. I encouraged her son to make sure she took the Core 4 every day, exactly as prescribed. 4 months later, he calls me and tells me I'm on a 3-way call with my mother. The doctor has taken her off of metformin and has told her she no longer has diabetes. They wanted her A1C to be less than 7. It's less than 5. She felt so good about the results that she told her son, "This is what you need to do." So he subscribed for the Core 4. He called me just the other day. He's been on the product now for maybe a month and a half. He says, "I don't know how to explain it except that I can tell there's a difference in my health." So I can't say enough about the products, my own experience, that of my sister, and all my family's on the products. So we're thankful to Dr. Prasad and for Dean for making us tell our stories. We do know that we want everybody to know about these products.
That's amazing. Thank you so much for sharing with us. Wow. Yeah, not only your experience, Dr. Prasad, did you want to make any comments on that? I'm going to pull you
No, I
up
mean,
here as
some of
well.
these things surprise me myself. I developed this product, but when you hear this kind of beneficial effect, it surprised me. And at the same time, very, very happy. That extend my lifespan, as I mentioned earlier, by a few months. So I might go to, 100, who knows?
We're going for more than that. All right. Thank you so much, Elizabeth. Dolores, so we're going to invite you up here onto the screen. There you go.
Oh, I just want to thank you, Dr. Prasad,
Thank you.
Jonathan, for introducing me to Dr. Prasad's products. It's a family affair with my family as well. We all basically are taking microdeli. I'm not taking it for any health issues. I'm just getting older and I want to maintain good health. And so I'm taking basically all of the products. My husband is on it. My children are on it. My grandchildren, my great grand. So it's a family affair with us. And I'm from the oldest to the youngest, from 87 to I have a great grand that's 2, I believe. They all of us take the products, and we're getting good results. It helps me to maintain good health. My husband has been taken off of. He's only on one blood pressure medicine, and that's the lowest dosage that they can give him. And sometimes he doesn't even need to take that. So we are doing well with our products. And as far as something Dean said about the formulator, I've taken natural products in the past, but I've not been able to meet the person that formulated the products. So I let people know we're not just taking something, but we are talking to the person that actually formulated these products, and we are on call on a weekly basis. We get questions answered, and if Dr. Prasad if he's not familiar with something, I do appreciate his humility. He will let us know. Well, I'm not sure, but he's going to find out. He's not going to ever tell us to do anything that, as far as going to get your doctor or whatever, that's left up to us. Whether we're going to, not. And to me, I don't plan to take any pharmaceuticals. If they tell me something is wrong with me, I tell my husband, the only thing I'm going to do different is to increase my microdeli. So microdeli is an excellent product. Thank you, Dr. Prasad. Thank you, Jeff, for introducing it to me. Let Jonathan send you back here to Albany, Georgia. So I thank all of you, and have a good evening.
Thank you, Dolores. That was amazing, and your whole family is involved with this, and it's been awesome to meet many of them in person and also over the phone. So, thank you. All right, we have Jenny that is next. She's got her hand up. I'm not seeing the camera on, but
oh, I can put it on.
All right, that would be
all right.
awesome.
So I want my husband to share. We were introduced, by Chris. All right, so Chris Fisher, and maybe I guess it was last fall sometime, probably September-ish. And we said look into the product, and so I've been looking into lots of products over the years. And so I said, okay, they sound good, things look interesting and good, let's try them. So we started on them, and then we found out about the C word that rhymes with answer, is what I'm hearing. So my husband had CLL, the chronic lymphocytic leukemia, and he wants to share his story.
Hi.
So Brian.
Many years ago, I was diagnosed with chronic lymphocytic leukemia. And January 2025, I had 9 things on my blood test that were out of range. And I had an oncologist appointment in December. And after talking with Chris, I decided I would go ahead and go on the cancer protocol after hearing about your father, Jeff. And I thought, well, it's not going to hurt by trying. So I was only on the protocol for 2 months prior to my oncologist appointment. And when I had the blood test, 6 of the 9 things that were out of range are now normal. And the other 3 had improved greatly, including my red blood cells. However, the one thing that kind of blew my mind was that my white blood cells were normal, and that's the first time in about 15 years.
Thank you.
So he is totally, well, we all are totally amazed and so appreciative. And our son is taking them, and now our daughter, who's an RN, is starting to take them and share. We're all trying to share. We're out here trying to share, doing our best because we totally believe in them.
Well,
So,
one other thing that I wanted to mention is when I did see my oncologist and was looking over the results, she was literally speechless. She didn't know what to say. And she really had no advice. So I asked her, I said, I would like very much to be able to have my blood tested more often. And so she gave me a prescription to have my blood tested every 3 months. So I'm going to wait here another month or so. I'm going back in, and that way I'll be on, well, probably 4 months or so on the protocol. And what my hopes are is, like many other people, is maybe I'll go into remission. I've been very blessed that I've not had to do anything with it other than watch it and pay attention.
Yeah, and when you do it a low dose, then gradually, if you think that you are in remission, and that it will be a good idea to from high dose antioxidant to normal dose. So gradually, not suddenly, but gradually decreases to normal level.
Well, that was one of the things that I had wondered.
Another thing that you mentioned, sometimes the doctor is not aware of. But if somebody says that, yeah, it's good results. But see, if you use a high dose antioxidant, that blocks two nutrients that cancer cell must know, they will die, survive and grow. All cancer cells, irrespective of types and stage and whether they are tumor sensitive or tumor resistant or treatment resistance, does make difference. As long as you are cancer cell, you need two, glucose, glutamine, for survival. And if you block it, you have no choice to die. So what high dose antioxidant does it? It blocks the entry of glucose and glutamine in cancer cell, so they start dying. And if you combine it with radiation therapy, see, radiation kills cancer cell, also normal cell. But high dose antioxidant do not kill normal cell. So you need combination, and they kill it by producing a lot of free radicals. And high dose antioxidant, that has nothing to do with free radical. It blocks the glucose and glutamine. So it further improves the effectiveness of chemotherapy or radiation if you decide to one. If somebody, I mean, not necessarily you, somebody does it, so it enhances further the effectiveness of chemo and radiation therapy.
Yeah, well, I can't thank you enough for what you've done for all of us.
yes.
I appreciate it with all my heart.
Yeah, truly. And if he was to be on this and back off a little bit, and then he has blood tests and it shows things
Yeah, say for
again.
example, I'm just giving an example. Suppose back off gradually.
Yes.
Do your blood test, still white cell is normal. Then continue to do it is a good idea to have every month or every 2 months blood test if you're off. But you take a normal, like core 4, which is very important, but not high dose antioxidants. So that will be a good strategy.
Okay. All right. Well, Jeff, he's been wanting to talk to you for so long about your dad and hear what, the follow-up sort of. So I don't know if we can ever connect with you in the future or not, but I know you're busy, but maybe at some point. So we're living in Northeast Michigan.
Okay.
People always have money around here for beer and cigarettes, but it's really hard to get them to buy good supplements. But we're working on it.
And when you are taking these things, don't take any other supplement. Because sometimes people think the other thing that could interfere with it.
Thank you.
Awesome.
Yeah. Thank you so
All
much.
right.
Be blessed.
Fantastic. Okay, let's Denise McClure, let's pull you on up here. Go ahead. That's you.
Yes. Thank you, Dr. Prasad. Thank you, Jeff. Thank you, Bernard. I thank all of you because we're such a young, happy family at this stage of our life from the Micro Daily products.
Yes.
I'm 72 and cancer-free for 3 years. And I amaze my oncologist every time I see her. And my husband is the poster child for microdaily because he was so very sick for years and years and years. He couldn't get out of his chair. He couldn't get off of the toilet stool without help. He was totally helpless because of a rare genetic defect that he has that caused him to experience what's called rhabdomyolysis. And Charlie and Bernard encouraged him to try the product and to just give it a chance. We had went to New York, where we live in Connecticut. We went to New York many times to see renowned doctors, and all they could do was put Band-Aids on his condition. And he was absolutely unable to function for years and years and years. And then it took 4 months because he was in a critical situation. But after the 4th month, he was able to climb the stairs without me assisting him. He was able to run up the stairs. He's 80. He can dance, doing the twist all the way down to the floor and up. He can do push-ups and squats, and he's all over the place. All our friends are amazed. They've seen where he's come from. He's like 18 at 80. It's a beautiful thing, Dr. Prasad, what you've accomplished with your research. Thank you.
Thank you.
Hey, Jeff, I just want to throw something in here with her.
Yes.
They keep sending me videos of him dancing with his daughter, and he's bragging. He's down doing push-ups. Even I have trouble doing push-ups right now. My buddy is on here, George Mickish. He's always on me to eat good, and George watches me like a hawk. And I'm actually getting better, George, whether you believe it or not. But with these two, they have been such an inspiration to the whole company that it is amazing what's happening with especially older people that's getting their life back.
Yeah.
And I just like to say, Denise, I've seen you and your husband go back. And I told Denise, I said, I can only imagine what's going on in that household right now. So I'll just leave it at that. And I have somebody else, by the way, that I'm gonna put on the spot because I've been getting calls all week. She's not in my line, by the way. Any affiliate that's on here, this is for all of the leaders. This is not a Jonathan Jones call. This is a call. This is all the legacy leaders. Jeff is the only ambassador. This call is for the sake of the company and Dr. Prasad. And y'all need to understand that. This is not a particular, and by the way, the girl that you're, Angelique Greer, he had something currently going on that's going to blow everybody away. So I'm gonna just let you know that before after you get into whatever. I'm putting her on the spot a little bit, but I'm gonna let her tell her story and her family.
Angela, are you able to come forward? There she is. Yes.
Yes.
Can you turn your camera on?
Yeah.
Yeah.
I don't know if you can see me. I'm at the hospital.
Oh. Uh-oh.
With my sister, who went in a little over a week ago, and we talked to Dr. Prasad on the phone when she went in. We had talked to the doctors. She has not been diagnosed yet. She has some type of muscle disease, but we don't know what it is. But it affected her breathing, so that they had to put her on a ventilator, because her muscles in her diaphragm are too weak to breathe. But this is the interesting part. I was just talking to the nurse, and she said that she's doing surprisingly well, because we're able to give her the micronutrients, because she has a feeding tube, and her nurse is giving her the micronutrients through the tube. The doctor agreed with it. and she's not sedated. And they said, usually when you're on a vent, you're sedated because you can't handle this, but she's doing so well. She's awake. She's been writing and writing. Everybody that comes in and visits, she writes, and she's and she said, the nurse said just now, that is not normal. So that's the update for now. We still don't, oh, and she's getting ready to go get the surgery so they could take the vent out. But we're still waiting for the diagnosis on the muscle disease itself.
But you know, in that scenario, the energy drink, which has a creatine, would be very useful. And it is dissolved in water, so it can be very easily give to her.
Well, actually, we've been using both of them, both EMF, the regular EMF and the hydro. We tried both.
There's a new product called Energy Boost, which you dissolve in the water, and and then you can go through the tube, inject a certain amount. That might be helping a great deal because it also improves muscle strength, especially creatine, because it generates quickly a lot of energy. And so that would be a very interesting thing. It's a water soluble, so it won't be any difficulty in giving it through the tube, and ask the doctor, and so that will be very, very important for her.
Okay, we'll check into that also. She's also getting the probiotic through the tube.
Yeah, probiotics is very good. Yeah.
That is awesome. Wow. Well, thank you for sharing right from the hospital.
Yeah, that's
letting us know these
very
things.
much, and I'm glad that she's doing a little better than before. So I'm glad that you decided to give her some, because body needs nutrient, and at least she can have a system by which you can give some micronutrient, and that is very good.
That's amazing. Well, thank you, Angela, for sharing with us, and for Dr. Prasad for adding some additional information there. We've got one last hand up here. It's iPhone, and I'm going to go ahead and just ask you to. I don't know who this is, iPhone, but you must have an incredible story sneaking right here in at the end of today's the session on stories. So iPhone, your microphone is open. Go ahead.
Can you hear me?
Yes.
Okay. So I'm having trouble pulling my picture up, but I'm Francis from Bogalusa. Different ones had mentioned to me about micro dailies for other health conditions, but I just pressed it off. But in October, I got diagnosed with breast cancer. And it was the hormonal kind. I can't remember the name. So I called my friend Liz Henry and I spoke to her about it. And we talked about it. And immediately she set me up with the bolus dose of micro dailies. So I started taking it. And with my work, October through December is my busiest time of the year. So now I'm working and I'm trying to wrap this diagnosis around my head, but I'm still going. So I took the micro dailies, I guess, for about a month and a half. And
I presume you are taking therapeutic dose.
I'm sorry, sir, I didn't quite understand. I'm taking the what?
High dose antioxidant.
Yes. So I took it for about
and
a month.
Probiotics. Yeah, good.
And I was feeling good, wasn't stressed. I was working. So I went in on the 9th and I had the surgery. And before I had the surgery, I had like 5 biopsies and 3 were negative, 3 were positive, 2 were negative. But during the surgery, only 2 were positive and the tumor had shrunk. And the doctor was so amazed. Everybody has been so amazed as to how well I have done. I'm very thankful that
Liz told me about the micro dailies, and I've been telling everybody that I know, because in my case, it really worked.
Doctor ever said anything that why you are getting so good results?
I'm sorry. Say that again, please.
Jeff,
Yeah, so
did doctors ever ask, what you are doing more than what they are doing so the results is better than expected?
I told them all I was taking micro dailies, my PCP.
So he didn't say anything?
She went online and she looked it up. She didn't say anything, but I told the oncologist, the breast surgeon, and the PCP that I was taking micro dailies. I told all three of them that I were. The only one that really showed amazement was the oncologist, because the report he told me I had like a 5% chance in 10 years of it coming back. And he just kept saying how well I did, how good my numbers was, and just everything. But nobody said anything specifically about the micro dailies but me.
The problem is until we run a clinical study, nobody will believe it.
That's right. Thank you, Francis.
Cancer center, but that's why, as long as people are happy, I'm happy. That's all.
So, Francis, thank you. And we do have one iPhone. You did unmute yourself there for a little bit, and Francis jumped in. So, iPhone, go ahead. Yeah, there you are.
Yep, this is Monya. This is Dolores Levat's daughter. First of all, I want to thank Dolores because she birthed me and introduced me to Michael Daly. Now I can thank Dr. Prasad because I have been taking Michael Daly for over 6 years. I started off with my blood pressure being high, and it has came all the way down from the EMF and all of my other products that I'm taking. I'm so thankful for this company because I completely stopped taking medicine. I also was going to the cardiologist for my heart, and metoprolol is what they had gave me. Not one day have I taken metoprolol. I started taking EMF. And so I don't have any problems with my heart. My blood pressure's down. I'm 63 and I'm talking about I'm fabulous. So I want to thank Dr. Prasad and all of you all because if my mother wouldn't have introduced me to it, and I have introduced it to other people and my family members, my children when they get sick, I've told this before. We make the little lemonade from the EMF. So I am so thankful because I walk around here like a spring chicken, and I look like one, but I can't. I'm at work right now, so I can't show no. But I'm thankful, Dr. Prasad. Yes,
Thank you.
and
Thank
to my
you.
mother for introducing me and helping me to get off these, the medicine. The medicine is they are killers. I don't want to take them at all. I don't. I refuse. So that's my testimony. I have a lot more, but I know we only have a little time. So, but that's it.
Thank you. Thank you for coming on and batting cleanup here for us. That was amazing. Amazing way to end today. And Dr. Prasad, wow, an hour has gone that fast. We've got well over 100 people here, and they've all benefited from these stories. Like Bernard says, facts tell, stories sell, and use this. Jonathan has it recorded. Send it out to those people that are having issues with that big C word that rhymes with answer. Send it out to people that have had issues in other aspects of their body or that are on a lot of medications. Let's see if we can't all help them all. So thank you for all of that. Dr. Prasad, thank you for being available. And we honor you in your 91st year.